Taking your health to heart here on CI Living at the City Center. A very special presentation this afternoon. Thank you for being with us. And part of taking our health into consideration is learning a little bit more about some of those specific things that can affect our bodies. And there's one specifically that can cause you to be short of breath, that can even cause enough pain to send you to the emergency room. And it's atrial fibrillation. That's probably the one and only time I'm going to say that word. Afib is how it's shortened, and we have an expert with us from Carle. His name is Dr. Anuj Garg. Thanks for being here. We appreciate it.
Thank you. Thank you for having me.
It's always a goal to bring in people that are smarter than me, which is really easy. So any and every guest is able to come on the show. But you specifically, tell us what AFib is and how it can affect sort of the everyday person.
So AFib is a very common type of arrhythmia. So normally our heart beats in a very regular fashion, like a clock beats. And when the heart has a normal rhythm, when it doesn't beat regularly, we call it as an arrhythmia. So atrial fibrillation is one type of arrhythmia where your top chambers, rather than beating at 60 to 100 beats a minute, it beats about 400 beats a minute. And it can make your bottom chamber beat very fast and irregular from 60 to 200 beats per minute. And sometimes people don't even feel it. It's very common arrhythmia. About 3 million people in this country, at least we know of, have it, and there are probably a lot more they have it.
Okay, so how does that affect the average person? If you don't feel it beating that fast, what are the effects that that's having on your body?
So the biggest risk for this arrhythmia is that when your top chambers don't actually beat, they just quiver so fast that the blood kind of pools around, just like in a pond. If you see at the edges, it's kind of muddy. The blood pools around, forms a clot, which can go up and can cause stroke. If your heart beats too fast, it can cause heart failure, where your heart muscle gets weak. And people can have chest pain, they can have shortness of breath, they may feel tired, or they may not feel anything. Or they may feel their pulse is irregular. So that's how they can know.
So two questions then, I guess. One, what can you do to sort of battle that once you know you have it? And the other question would be, how can you keep from getting it? So let's start with the first one. If you have AFib, what do you do?
So first of all, you have to diagnose. A lot of time, as I said, people don't feel it. And nowadays, a lot of people have smartphones, apps, which can detect atrial fibrillation. Sometimes people can feel the pulse, which is irregular.
There's literally an app for that?
Yes, you can have app. Basically, you can put your fingers behind that, or you can put smartwatch. It can look at an EKG. You can email it to a physician. You can show it to them. Or you can go to your doctor, and they can do an EKG or a monitor. And through that, we can detect atrial fibrillation. And what was your second question?
I guess the other question would be, on the other side, if you don't have it, how can you prevent?
So first of all, you have to know what the risk factors are. The most common risk factor is aging, which you cannot prevent. If someone is getting old, there's not much you can do.
That would be breaking news here on CI Living if you had a way to battle that.
And then you look at the heart causes related to the heart, like if you had a heart attack or a weak heart muscle or some valve issues. And the non-heart related issues will be like diabetes, obesity. The most common reason I see is sleep apnea. A lot of people have obstructive sleep apnea where they stop breathing at night, or alcohol. So that all can cause. So people who are at risk from that, they should be much more careful.
Diet and exercise, do those play into it at all?
So obesity plays a role, sleep apnea plays a role, diabetes, they're all connected. So it's just a symptom of a lot of diseases, and it can happen independent of all these too.
Well, thank you for the information. I know we had to go through a very complex situation very, very quickly, but you did a great job of explaining it. We appreciate it.
Thank you.
Thank you. Thank you. And we will connect you with all the details that you might need if you have other questions about AFib on our website, which is ciliving.tv.